Raising Cain over Medicaid. This afternoon, people packed a University of Memphis ballroom, voicing concerns about a proposed major change to TennCare, the state's Medicaid program. Good evening, and thanks for joining us. I'm Katina Rankin.
I'm Richard Ransom. We start talking about health care. People's ears perk up. Governor Bill Lee wanting nearly $8 billion in federal funding to come in one lump sum known as a block grant. Uncle Sam would have very little say over how the money is spent, an experiment that would be the first of its kind in the country.
And Local 24 News reporter Brad Broders, he's live in the studio now to explain all of this. Brad?
Certainly a talker today, Katina and Richard. Today's public hearing wasn't originally scheduled for Memphis, but that changed after an outcry from lawmakers and doctors. The stakes are especially high locally, considering more than 1 in 6 TennCare recipients statewide are right here in Shelby County.
We can't do anything for those who cannot access care.
This afternoon, Baptist women's doctor Craig Sanders stood up and opened up. He's worried that if TennCare's funding is dramatically changed, current patients could potentially be kicked off coverage.
It puts their babies at much more risk by not having good prenatal care.
Cervical cancer survivor Terrence C. Bond, who said she was denied TennCare coverage last year, echoed that concern at this public hearing.
They go to block grant, that means I'm completely wiped out. That means I have absolutely no options, at least not in this state.
Governor Bill Lee believes funding TennCare through a modified block grant would allow the state to be more flexible in how it spends and operates federal funding. But speaker after speaker here today weren't so sure.
We've had questions of constitutionality. We have questions and concerns about lack of oversight.
Now that they've spoken, Dr. Sander hopes lawmakers in Nashville listen to Shelby County, easily the most reliant in the state for TennCare, with more than 250,000 recipients.
If you're in public service, you should care about health care for all the citizens of our states.
Now, this proposal must still be looked through and eventually signed off by the Trump administration in Washington, a process which is scheduled to begin next month. If that happens, the state legislature would still have to give final approval sometime next year. Reporting live in the studio, Brad Broders, Local 24 News.
Brad,